So to get us started, welcome. Thanks for coming, everyone. We're super excited to be here. And really today, it's the start of this three-part series, and we're going to just lay the groundwork for the second part and the third part to this series, which is really all around how do we do this thing called evidence synthesis, the science of evidence synthesis, and how do we use it to inform policy and decision making? And that's really the frame here, but we're going to talk about through all the good steps of that process. So as I mentioned, we have Amy Corder, who's a research support librarian at the Mattis Library of Health Sciences at Tulane. Amy, feel free to jump off mute and say hello.
Hi, everybody. Thanks for coming.
Thanks, Amy. And then we have Laura Wright, who's the coordinator of research services at the Mattis Library of Health Sciences. Laura.
Hey. Hi, everyone.
Cool. And then there's me. Hi, everyone. I'm Christopher Stoyanovsky, and I'm a professor in the Department of Social, Behavioral, and Population Sciences. And one area of my program of work is using the scientific method of evidence synthesis to engage in policy and program decision making. So for today, this is kind of what we expect. This is the first part in a three-part series. It's going to be roughly a 75-minute workshop. We do have some active learning and knowledge poll assessments today. We're going to share a lot of tools and resources, and we're going to make it a bit more interactive. And then I also want to just share what this tool is that we're going to use. This thing is called Padlet. You'll see a link coming in the chat. And this is a space for us to hold any questions that you all have over the course of today. But also we're going to use these to answer those questions in session 2 and session 3, and kind of as a co-working space to track. And all you have to do is double click, type in your question, and then you just publish it. And that's the end of it. We're going to be monitoring this over the course of today, raising these questions, answering them over the course of today's session, but then also over the course of sessions 2 and 3. Are there any questions about Padlet and how Padlet works before we continue? So for today, we have a few objectives that we want to hit. We're going to really introduce what evidence synthesis is. We've all heard terms lit review, but it's so much more than that. There's a lot of steps, which are then going to outline those steps. And then we're going to start crafting research, or what I would call more policy related questions for evidence synthesis, and then give you lots of helpful tools and protocols over the course of today's session. So what is evidence synthesis? At its core, basically what we're trying to do is bring together information from a range of sources and disciplines, all on one specific topic. And then there's a scientific way in which we do that. It's systematized. We want to make sure that we're tracking that systematic approach. We want to make sure we're having well-formulated questions. We aim to identify and synthesize all of the literature on a specific topic. We're not just trying to find one specific piece of information. And then ultimately, it needs to be done in an unbiased and reproducible way. And ultimately, all of this is informed by what your policy relevant question is, or the decision you're trying to make. Few different benefits of why evidence synthesis, and I think there's a few exciting pieces here. Is one, first and foremost, is there's too much science out in the world to make sense of, and we have to make sense of it, given that we live in this complexity. And so how then do we start to bring all that research and science across those disciplines? It really is rooted in application and practice. That's our focus today. Yes, there's this whole scientific piece to it, which is publishing articles and systematic reviews, but we're really thinking more about taking that evidence and putting it into practice. Here's the unfortunate one, is it takes roughly 17 years to translate scientific evidence into practice. And so we really do need to accelerate that process. For those of us that are academics or work in that research world, evidence syntheses are the most cited research out there. This is really because it's drawing on all the different research out there. The most cool part, which I do a little bit of system science work, is really How do we take the whole body of scientific evidence on a topic and start to understand and map that complexity? And lastly, evidence syntheses are the main scientific research that decision and policymakers are interested in. So they really want to know if that decision and policy they are making is sound based on all the data and science that is out there. And so evidence synthesis gives us that tool to do that work. So here I'm going to switch it over to Amy, who's going to just do a little quick knowledge poll check. So Amy, I pass it over to you.
Thank you. We have a link that I am sending in the chat, and we will be doing a knowledge poll. So just follow this link in the chat. I can try to pull up this QR code again and just in just a moment. And we will get started with that. So you can either follow that link in the chat, scan this QR code. There's 3 questions. One is multiple choice. One is a word cloud. Another is multiple choice using facial expressions. And hopefully everybody's either scanned that QR code, and I'm going to go to the knowledge poll itself. I hope everybody can see what I'm seeing right now, where it shows people filling out the knowledge poll. Okay, so we've got about 20 people that have filled it out, and a few more people that are still filling it out. So I'm going to go ahead and start reviewing these questions. So the first question was, have you ever conducted or worked as part of a team for an evidence synthesis? And so there's yes, is 57% of the respondents, which is great. No, 26%, and I'm not sure is 17%. And if you're not sure, the term evidence synthesis will hopefully explain that to you, and you'll figure out, hey, I have, or I haven't, or oh, now I know what you mean by evidence synthesis by the end of this workshop today. And so what comes to mind when you think of the term evidence synthesis? It made a word cloud. So literature, data, knowledge, review and reviews, making, multiple. Those are kind of the big words, but you can see a few other smaller words: recommendations, summarizing, accuracy, evidence. So you can see a lot of different things, and one person said big, or somebody said big as well. So yeah, I'd say just interesting to see what everybody's kind of thinking about this type of research. And how comfortable do you feel engaging with research literature? 65% of people put the happiest face. 13 did, the in-between, happy, medium face, and 4% kind of put in the middle. I get by, I'm not 100% comfortable. So hopefully, but this workshop today will also kind of help you understand what we mean by evidence synthesis, so that you can feel a little bit more comfortable, a little less overwhelmed when you're engaging with the research literature in the future. So Christopher, over to you.
Thank you, Amy. So we're going to just outline some of the main steps of evidence synthesis really quickly. And then as we go through today's session, we're going to go into a little bit more concrete information on each one of those steps and things for us to be thinking about in relation to evidence synthesis and policymaking. So next slide, please, Amy. So these you could think of as just the 8 broad steps in an evidence synthesis project. You have the first one, which is really writing your protocol. This is you thinking through, what are my research questions? And when I say research questions, I'm also talking about policy relevant questions. What are that inclusion exclusion criteria? What literature do I not want? What do I want? Starting to think through what your basic search terms and how you're going to synthesize that information. And then step 2 is really going into the search, conducting it, getting all those references and citations. We use Covidence on our team, on my team, and we uploaded that into Covidence. And then steps 3 and 4 are really where we're screening that scientific evidence. Does it meet our inclusion criteria? And then steps 5 and 6, we're starting to extract, the pertinent, the relevant information only. We're not extracting everything from each study. It's really only rooted in what our policy or research question is. And then step 7 and 8 is really synthesizing that information, that evidence, and then thinking about how we're going to present that out to policy and decision makers, or in the scientific literature as well. Are you going to publish that in a journal article? So that overall is what this process looks like at a general level.
Thanks, Christopher. I'm going to go into a little bit more detail about the first step of evidence synthesis, which is our main focus for this session. So when you're trying to determine what you want to look at, it is important to remember that the research question guides the entire method and the project. So the question directly points to the information you're searching for, which is kind of, it makes sense, but when you get into the research, you really want to think about the type of question that, because it may inform the type of evidence synthesis project you undertake. So in general, a narrow and specific question is recommended. So instead of my topic is diabetic retinopathy, what would you like to know about diabetic retinopathy? For example, asking who, what, where, why questions to narrow your topic. So this is where preliminary searching can help you get an idea of the amount of literature out there on the topics you're considering. And beyond formulating your question, there are some other things to think about. So the first one is there already a review published on your topic? If so, you might want to find another topic. In some cases, you can update older papers, but any recent reviews should be kind of left alone. So consider looking for something else so you're not duplicating research that's already out there. If there is not a review or some type of evidence synthesis already out on your topic of interest, see if there's actually, see what kind of research is out there. If there isn't research available, then a review probably is not needed. But if there is a good amount of information, would people in the research area benefit from having that research evidence synthesized? So the reason we bring this up is the last few years, the amount of systematic reviews and other review articles has really skyrocketed. So just thinking about these details on the front end of your research, if you're hoping to get published or just working on it generally, is just to make sure you're not duplicating existing research that's already published. And your research question should guide those key terms that you're looking for. So what we mean by that is look at your question, identify those key concepts in the research question, and think of synonyms for those terms. We will be going into this in a little more in a bit, but a question framework can help you develop your question. One that we mentioned in the slide that a lot of public health practitioners use is PO, or population, exposure, and outcome. And we will also be sharing another framework with materials to look at in our active learning and for the homework as well. So there's quite a few other question frameworks that can help you turn a few concepts into a coherent question, or vice versa, help you turn your question into divided up into the concepts.
And I think for us to think about this too, in terms of doing the work of policy and decision making, your research or policy question might be informed by the debates currently happening like right now in society. So in a course I teach on this, for example, the students put together a review of cannabis and the health impacts of cannabis legalization, given that the state of Oklahoma was in the process of deciding whether or not to legalize marijuana in Oklahoma. And from that review, what the students ended up finding was that it was actually like pretty terrible for the health impacts, and like there was no cost savings in states that have legalized cannabis, and like all of that was because the state of Oklahoma was literally right now in that moment thinking about what do we do with this policy, this legislative decision we're making. And so that is also a way for you to think about what that research/policy question is.
Yes, like looking at the world around you and thinking of what kind of questions do I have that I need an answer to from research literature? And this question will help you to write your protocol. So a protocol just really describes the rationale, hypothesis, and plan methods of a review. It's similar to submitting a protocol for IRB approval if you've ever done that before, except this is a literature review, so it's really for you. It should be prepared before the review is started and used as a guide. So they can be made publicly available and registered in a protocol registry depending on if you're trying to get published or anything like that, but it is not necessary, depending on what you're doing. But just like any other type of study you would do, writing a protocol, even if it is not registered, on the internet somewhere, it helps you because there need to be defined steps to follow. In order for this methodology to be well done, it needs to be clear why you came to why you found the literature you found and why you came to the decisions that you or to the conclusions that you came to. So think about if you're doing a survey, if you're going to be surveying people, you want to figure out how your survey fits into the literature, how to develop that, how to disseminate that, and how you would analyze it. So with this, you would want to have all of these ideas of the steps identified ahead of the time, even for a evidence synthesis project, so that your work can proceed smoothly, and it allows for reproducibility and transparency of this research, since it's literature-based and not people or experiment-based. So this helps with reducing bias by reporting what methods will be used ahead of time, and helps the whole process be transparent. It also can just help everyone on the team stay on track, stay focused, and help prevent issues like not knowing what are the inclusion and exclusion criteria, or adding information that is not relevant to the review. So we have links on this slide, and we will be sending them out afterwards, to 2 ways that you can see registered protocols. And one of those is Prospero. That's a systematic review protocol registration platform. Another is the journal Systematic Reviews, which allows authors to publish protocols in advance. So even if you don't register a protocol through these methods, these are great ways to see other protocols on your exact topic and get a sense of the information that is included on these protocols. So detailed protocols, I always like to emphasize, these should be developed beforehand. I mentioned this before, but they just prevent arbitrary decision making. And if you get it peer reviewed, why did you come to this conclusion? It lays out everything that you planned to do. And if you follow, that can enhance the rigor of your literature review or evidence synthesis project. So now we have a quick active learning. We are going to divide everyone into breakout rooms of 5 or 6 per room. And we have a document with directions, if someone can send that in the chat. So basically, this is just to help you brainstorm a research question, because ideally we'd like you to kind of get some hands-on experience with that. So in a sentence or two, there's a document that kind of lays this out, describing your broad topic, then breaking it down into the problem, and why are you wanting to research this topic. So not everyone in your group has to have the same topic. You can choose if everybody wants to kind of look into the same thing, or if you're all interested in different things. But basically what we want the groups to brainstorm as many questions as you can to that desired research topic, so you can kind of get used to what it feels like to develop these research questions. We'll be giving you about 15 minutes. If people have questions, we can pop into the rooms and, help you out. I'm not sure if anybody has added this PDF of the resource to the chat, but just use this worksheet to talk over with your group, and it can help you tighten a focus from a broad topic like diabetes to something that is a specific question that might be relevant. Diabetes is just one example. You don't have to choose that topic, but something that might be relevant that that you're curious about, or you see in your life or work, that you might want to look into over the course of this workshop series. Also, the homework will go more into this, but I am going to mute myself and divide everyone into, oh, we've got rooms already developed, so everybody can go to their rooms and we have about 15 minutes.
Looks like the rooms might be a little bit bigger than originally planned. We might move, oh, I don't know if we can move folks around.
Breakout rooms are almost closed, but I hope everybody found this helpful to kind of think of questions and breaking down those questions into topics and vice versa. And so, yeah, we'll move on to the rest of our presentation. And so I hope this exercise was helpful in kind of breaking down the question into topics so that for the next steps of the evidence synthesis that we talk about, you kind of understand why we're taking so much time of thinking about this question. And we'll be reviewing the other steps of evidence synthesis that will be getting into more detail in the other 2 workshops, but kind of giving you an overview.
Thank you, Art. Yes. To what extent does the question ask? So what is that? Does purpose and audience matter in framing and determining the questions and methods? Absolutely. I would say that is the biggest factor that's going to determine what your protocol looks like. If you are writing this for a scientific article and you know you want to publish it, like that whole process is much more detailed, in-depth, much more rigorous, systematic. If you are doing this for policy decision making, not that it's not rigorous and systematic, but we're speeding up that process. We might search less databases. We might have less search terms. We might even tailor more specific our question if it's in response to a particular policy that's unfolding. But that is a great question. I'm going to add that to the Padlet for us to continue thinking about that as we go on. And then do we have to use a framework? Doylin asked. Yes, there is one, and you'll see, we'll share some actually in a little bit when we talk about some frameworks that'll help you guide your protocol development. Cool, so we will continue on and I'll add these questions to the Padlet and we'll get to them throughout the session.
Great. Okay, so we just dropped that link back into the chat for the worksheet. If you all have any trouble accessing it or need more access to it later on, please let us know. And I would like to say RTA for representing room 3. It was a great room, lots of engagement, and I think y'all are really close to actually getting it nailed down to a research question. It almost gave me like tears of joy as you were talking. So, but now we're going to talk about inclusion and exclusion criteria. This can also be referred to as eligibility criteria. Now, eligibility criteria should be determined early on in the evidence synthesis process and worked into your protocol. So eligibility criteria can include a variety of things, such as the population group you want to look at, study designs, such as including or excluding cohort studies, quasi-experimental study designs, controlled trials, or a date range that you're interested in finding information about. I think when we're talking in the context of health policy, the date range stands out to me as an important thing to think about due to changes in policies and laws, and it can help you focus on what is really of importance on that topic, depending on the scope. So one thing you do want to be sure of is that you have a good, clear, defensible reasons for each of the criteria you include. When you're doing an evidence synthesis project, you are trying to find all of the relevant information on a topic, and by limiting what you're looking at, there's the potential to introduce bias into your synthesis and findings. So have an answer for the question, why did you choose these eligibility criteria? Next slide. Thank you. Okay, so let's talk about finding all of the information for your topic. When you're working on an evidence synthesis project, where is all of your data coming from? It's coming from the literature. You're looking for all the research already done and synthesizing it for others, and to get a good understanding of what already exists on your topic. So when you are designing your project, it is really important that you work to define all of the different concepts that are relevant to your topic. Create a list of relevant databases and gray literature sites and clinical trial registries if necessary, and make sure that you know how to use those databases properly. Your evidence synthesis project will only be as good as your search for information. If you miss an important article or more than just one, it will change the outcome of your review and potentially make it less helpful depending on which articles you end up missing. With that being said, always aim to use at least 2 databases for your project. Databases have their own individual scope of what they collect in their collection, And it's important to make sure you're searching in multiple relevant databases to ensure you're not missing any information. So go to the next slide. Okay, so now what are your options for accessing scholarly databases? If you are affiliated with a university, you should have access to all of your library's database subscriptions. If you live near a university, but are not affiliated with that university, call the library to see if you can come in and access the databases on a computer at the physical library. Now, if you don't have access to a university, either as an affiliate or a local resident, check out your public library. Public libraries also subscribe to these databases, and you can access them for free. So check out your local library's website or stop on by. If you don't have a library card, you'll probably need to get one to access the resources. Okay, so here are some options when it comes to scholarly databases. PubMed and Google Scholar are both publicly available databases, so you can get to them without having to worry about payment or paywalls, anything like that. We don't usually recommend Google Scholar for evidence synthesis as it's incredibly difficult to replicate. And that's really something we focus on a lot more when we're looking at like published reviews and things like that. You definitely want to use what you have available to you. Don't limit yourself just because you don't have access to any of these other ones. If Google Scholar is what you have, Google Scholar is what you have. So Medline, which is a subset of PubMed, CINAHL, which is a nursing and allied health literature database, Academic Search Complete, ERIC, which is an educational resource and information center is what that stands for, and SocIndex, which is a sociology database, are all available through the Louisiana public libraries. But there are many more databases that work well with public health topics. So definitely stop by your public library and see what they have available to you already. All right, now let's talk about study selection, my favorite part, or how to figure out what papers you want to include in your evidence synthesis. After you've determined your question and searched all of your databases, you're going to have a nice big collection of information. However, most of that is probably not going to fit into the exact question you want to answer. So you screen this in 2 different phases. So you start out by screening articles based on their titles and abstracts. So you read the title and the abstract and see what the article is about. Based on that, you can usually determine which studies are overtly irrelevant and get those out of the way early so you don't have to take time looking at them. A lot of them will be interesting, but they still need to go. So your next step is to screen the full text of the article. So after you've done the title and abstract screening. This means actually reading the papers and ensuring that the papers fit the inclusion and exclusion criteria. In this step, you will get rid of more papers and you will end up with just the papers that can help you answer your question. After you've decided what articles to include, you can look at the references of those articles and see if there's anything of interest that you would like to look into more for your synthesis. So we in the library biz call that hand searching, as we used to have to do that by hand. Much easier now. Okay, next slide. Okay, so once you have identified all of the papers you want to include in your evidence synthesis, your next step is going to be data extraction. So data extraction is basically pulling out all of the important information from the studies you're including, such as the population being studied, the intervention being used, the number of participants in a survey or study, the main impacts or findings, things like that. As best practice, think about what kind of data you want to extract while you're working on your protocol. You don't have to have everything set in stone, but just start thinking about it. A good way to do this is to develop an Excel spreadsheet that allows you to input all of the data and then sort and filter as necessary. There are also programs available online that can help you with building out forms for data extraction, and we'll be talking about some of those later in this workshop series. Okay. So quality assessment or risk of bias assessment or critical appraisal, this helps to establish transparency of evidence synthesis results and findings. So a risk of bias assessment is often performed for each included study or paper of your review. This can help identify included studies that include bias in their results or conclusions. For example, studies or design flaws that raise questions about validity or findings, or an overestimate of an intervention effect, things like that. There are quite a few tools available for free that can help with the quality assessment of articles, and you can find them based on the types of studies you are assessing. One that I really like to talk about is called the Newcastle-Ottawa scale. They have quality assessment scales for case control studies and cohort studies that are pretty straightforward and easy to use. And there are lots of others available as well. So go ahead and we'll move to the next slide and to
Well,
Christopher.
this is Christopher. I was going to jump in on that last
Yeah.
on the quality assessment. And, you know, what we're doing with today's conversation is like it's a little bit of both science and also like application to the real world. These quality assessments are super important from a scientific standpoint. And if you want to publish your evidence synthesis, like you absolutely need to include these quality assessments. That link, when you get the slides, you can click on that thing here and you'll see all the different tools. What I would say though, for policy and decision making, I don't know that you would present the quality assessment results to the policymaker. I don't think they really like care for them to be like, oh, I want to know X percentage of the studies. That's like your job as the person to sift through all that, present only the higher quality information as part of the review when you're engaging in your policy and decision makers. But I wouldn't actually formally present a quality assessment like I would in a scientific article.
Right. Yeah, and you don't have to follow the templates and stuff exactly. What's really good about these, especially when we're looking at this in the light of health equity, we want to make sure that we are not including articles that include bias. So that's really the most important part. Thank you, Christopher. And I think we're back to you.
Yes, thank you. Yeah, I appreciate that. So as step 6 of the whole 8-step process that we've been walking through, right now we're in this final kind of stages. So you've taken all the data from your studies, right? You may have these really nice tables of the extracted information related to your policy question, and now I need to make sense of it all. And so what your data is that data you extracted from every study. And so there's a few then ways for you to think about how you're going to analyze it. Meta-analyses are one way, which is typically the quantitative way to look at all the different statistical results from all the included studies. What typically happens here is if you're going to do a meta-analysis, though, you have to have those studies all be part of the same study type, because it wouldn't make sense for us to do a meta-analysis of the statistical results of a cross-sectional study and a randomized control trial and like pool those together because they are being measured in different ways. In addition to a meta-analysis, you can do a narrative or thematic analysis. And this is the work that my team does a lot, where we're looking at these different heterogeneous studies, and then we're looking at the different types of like study design types, and we're summarizing all that data qualitatively. So now that whole set of data, what we extracted and everything, that lives as like almost like a qualitative data set. And then we're analyzing kind of overall high level themes, conversations across the studies to see what we're learning. You'll see an example in one of that we give you for the homework. A review we're looking at right now is this looking at the use of race in medicine. So this thing that we know is socially constructed, race, how is it being conceptualized in the research literature? And then how is it being tested against clinical outcomes, for example? What we're seeing out of that review are things like folks are measuring this concept of race in clinical medicine via scales, implicit association tests, vignettes where they, change the patient, Black versus white patients. What's interesting about that is like all of that literature is so diverse and measured in so many ways. And what we're seeing is that if you measure things using implicit association tests, those are not showing up as significant findings in the data extraction. But when you're doing clinical vignettes, those are having more significant findings in terms of shaping clinical care. So these are some of the questions that you're going to think about are really like, what is that policy question I'm setting up at the beginning? What is that research question? And then your whole analysis is around that. All the extra information that might be in these studies and in the data, you are basically ignoring at that point. And then the last if we can go to the next slide, is synthesis for policy. So here, I think, is where you get to be a little bit more creative and fun. So for this whole project, remember, we're bringing together data from all these heterogeneous studies, and we're trying to draw some larger claim about the whole body of evidence. So what we want to do here is really, we're synthesizing the learnings as they are applicable to the policy and decision maker. If you're doing this for a research study, it's going to be based on your research question, right? But for a policymaker, we're really hyper-focusing on only the results that they can use to then go on and make a decision based on what you found. And what we need to do is also communicate this in an easy to understand way. It's not going to be in a research study. No policymaker will ever look at that. But what we do with some of our work is we create infographics, one-pagers that synthesize everything really quickly. But then in the next step, in writing for policy, if we can go to the next slide. A thing that I want to share here is really, we're only sharing the findings relevant to that policy or decision that needs to be made. We're recommending specific courses of action based on the data we reviewed. And at the same time, we're girding against potential counter arguments. So in one of the class I taught, I mentioned the Oklahoma case study. Folks were trying to gird against some arguments like, oh, well, folks, they imagine are going to make economic arguments for why we want to legalize cannabis in the state of Oklahoma. This is actually predominantly why everyone has been legalizing cannabis, is because it is revenue generating, and we recognize we want to correct past harms in the criminal justice system. But what we end up seeing in the literature from that review was actually that there is no cost revenue savings with cannabis legalization. There's actually more hospital admissions. We are seeing an increase in psychiatric outpatient issues. And so all of that was then incorporated into their policy recommendation. We don't think you should legalize cannabis because the cost savings are not real. We recognize that this is your purported revenue, but because of the hospital admissions, all that good stuff, all that came out of the synthesized literature and research. And you can tell, like, the way they wrote that, it was a one-page document with an infographic that came with it. And that was what they delivered to the policymaker. There was no scientific article. We didn't do any of that. However, that is the next step. And if you want to publish your work, when we share this presentation, look in the notes for some more details about writing for scientific literature versus writing for policy. Cool. Oh yeah, Carla, please. Yeah.
We want to give recommendations, but then you work for an organization that is not allowed to give recommendations, but they still want a policy brief. And so does it fall short, and is it just we can't give recommendations? So what is your suggestion there? Yes, synthesize the evidence, but then there's like a cliff and you're like, now what?
Yeah.
How do you even package that? Sorry.
Yeah, no, I think that is an absolutely critical question. Something I would say, and this is where we get into the space of advocacy and lobbying versus writing proper scientific communications. And so one thing you could do is lobbying, right, requires us to have a specific law. I want you to vote a specific way. We don't have to do that and say that we want you to vote no on this, but rather we could offer, yes, I like what Dennis is saying, some education and advocacy to be like, well, here is what the literature shows us about cannabis legalization, but I'm not telling you to vote any which way. Does that make sense? I would just present the data. It's harmful, or like there's economic costs. We're seeing increase in psychiatric and it's more of just presenting that information. And then they can read between the lines.
Right, it's just an art.
Yes. And as we go through this workshop series, parts of the resource you're going to get is doing some of that. We'll give you examples of infographics, policy memos, things like that.
I think part of the answer is marshaling the evidence. So without making any recommendations. If the preponderance of evidence presented basically is obviously suggestive of some course of action, you're recommending something without recommending anything. The other approach that I've also used is I've taken a look at identifying information that is likely to be considered as legitimate and evidentiary by my audiences, and really emphasized that, really focused and emphasized that literature, either supporting it or making efforts to undermine it, depending on the recommendations or depending on the advocacy that I'm interested in. And that sounds more difficult than it actually is, because, it's easy to look at any research and identify the weaknesses associated with the research, the things that might lead to counterfactuals, for example. So it's something definitely that you can do if you're interested in advocacy. And then I just want to make one last comment, and that is that I think publishing is a kind of an act of advocacy. We're advocating for a particular theoretical perspective or model or framework, instrumentation, whatever it is it might be. We've made some value judgments in the course of developing the inquiry, conducting it, and analyzing the data. And those value judgments that we're making, but they basically conveyed and communicated in the publication or the presentation that we use to disseminate our findings.
Yeah, no, thank you for that, Art. That absolutely. I super appreciate that. Yes, let's keep it going. I'm recognizing we're coming up on time, but over the next 2 sessions, we'll engage a little bit more of this conversation as well.
Hi, sorry, I was going back and forth on the slides. If I accidentally touched my mouse, it kept switching. So this next slide is about rapid reviews. So this is kind of the big focus for this workshop series, because as the name, it follows the same steps as other evidence syntheses, but they may provide more timely information, a little bit faster compared with standard systematic reviews. For example, on average, systematic reviews can take between 12 and 18 months or longer. So for this workshop series, we're kind of concentrating on rapid reviews, although the methods are quite similar. For example, you might have much shorter deadline as if you're communicating with policymakers. So this omits stages of the systematic review, which is less rigorous, but it is best designed for new or emerging topics, updates of previous reviews, critical topics, or assessing what is already known about a policy or practice using some systematic review methods. So, for example, a great example is in 2020, when the COVID-19 pandemic happened, lots of rapid reviews were developed. Some were published as systematic reviews, but really, if you look at the methods, they were rapid reviews, and now they would have been considered a rapid review. But systematic reviews usually take over a year to perform. But for example, by the end of April and beginning of May 2020, there were lots of articles calling themselves systematic reviews related to COVID-19. If you look at that methodology of some of those, they were really rapid reviews. And so now most of those published would have been considered rapid reviews. So rapid reviews still search 2 or more databases. 2 reviewers are preferred for study selection, but sometimes 1 reviewer can be used just for the title abstract screening phase, and 1 researcher may perform data extraction and risk of bias assessment as well. So we will be going more into rapid reviews, but that's kind of the type of evidence synthesis that we're concentrating on for this series, because it might be more practical to you all. And so next, we have a link to a handout with a few helpful resources. We have a lot more than I listed on here, but the first 3 bullet points, these manuals, the Joanna Briggs Institute Manual for Evidence Synthesis, Cochrane Handbook for Systematic Reviews of Interventions, the Campbell collaboration, those are kind of guidance on how to conduct different types of evidence synthesis depending on the research question and what you're asking for. But generally, I recommend reading through all of those. Most of the same principles apply. There just might be some slightly different things done in the methodology. They all require a protocol. They all require, laying out your plan and following that plan. So these are great resources that we'll be sharing in the chat. Laura has shared in the chat, and even more information for you to just take a look through on your own time and learn more about evidence synthesis. And now we're going to open up the floor for some more questions. We don't have a lot of time, but I'm going to go to the Padlet right now and kind of see what's happening in the Padlet. Someone asked, how many databases should I search? And I mentioned this, two or more databases, but for policymaking, when you don't have much time, 2 databases might be enough. I say, as long as they're looking at different types of literature, so I would say, maybe depending on your topic, 2 databases at least. Someone asked, how do you differentiate between your primary and secondary questions? Must the secondary support the first or be aligned with the answer of the first? Should we be referring to the same sources for both the primary and secondaries? The primary, I'll speak from my experience, the primary question is your main research question. The secondary questions might be, if this information is included in the article, we would be interested in this, but if that information is not there, it's, as long as that primary question, the articles you're including answer that primary question, you might have some secondary questions that you're interested in, if you see a trend in the literature. Would anybody like to clarify what I'm saying?
No, I appreciate what Amy you're bringing up here. And I think one of the things to think about in terms of quote unquote primary and secondary questions with evidence synthesis projects is that you want to set up your search and work in a way that the data set you get to, those articles, will allow you to answer both those questions, if that makes sense. So it becomes harder when you're trying to roll in multiple research questions into one data set of articles because you need inclusion-exclusion criteria across your primary question, your secondary questions that you have, and then you want to make sure that your studies are meeting those inclusion and exclusion criteria for then multiple criteria for multiple questions, which then makes it harder to do the screening process. To say that it's not possible, like I don't want to say that it's not, it just takes a little bit more planning at the forefront to make sure that that group of articles you get to is really the data set of articles for your primary and secondary questions.
We don't have much more time, but I wanted to look at, someone asked, what strategies are there for finding a well-represented pool of literature that's not just white and Western, dealing with languages and translations? I guess there are a few strategies out there, including, I would say, a lot more Western countries have a lot more published peer-reviewed research, but that doesn't mean that you're going to not find things in other languages. A lot of people will restrict languages because they may not have a speaker or reader of that language on their team. But if you do have someone on your team who can translate and understand literature in other languages, that really increases, the literature that you can review. But there are lots of databases out there, depending on where you're affiliated with, that have more international research that might be based in Africa, Asia, and even Europe. A lot of our American databases have less of that, and also that can be a part of your risk of bias assessment, is seeing the characteristics, especially if you're looking at clinical studies, for example, seeing the characteristics of the people that were studied in the research that you're looking at. If you realize that the only people in the study that were studied were white men within, college-aged white men, maybe that should be something that's addressed in the risk of bias assessment, that it's not a representative sample of the population. So There's quite a few strategies out there. I don't know if anybody wants to continue. We're kind of running out of time.
I'll jump in real fast if that's okay. So there's a lot of databases that aren't academic databases that you can search, a lot that are put out by governmental agencies or non-governmental agencies, things like that. So if you look at like the CDC website, for example, is one we use a lot, they're going to have a lot of literature there that's not necessarily published in research journals, but it's still good literature that you can use. The World Health Organization is another one, the IDB, the Inter-American Development Bank. So look for the organizations that you tend to look to for information and see if they themselves are organizing it for you.
Cool. We're just going to take some time as we are wrapping up in the last few minutes. We want to learn from you all to see how today went, and also think through what we might need for sessions 2 and 3 to improve upon, or other information that we missed. We would love to hear from you all. So we're going to just give it a couple minutes. We'll go quiet to let you complete the survey. You can scan the QR code or use the link in the chat. And then stay on with us right after the survey, because we do have the little homework assignment that we're going to introduce to you all, and then you'll get an email from us with more information, resources, context, examples, and so on and so forth. Cool. Laura, do you want to introduce the homework assignment?
Sure. So this is the homework assignment that we have for you today. We're going to go over pretty much those basics of what we talked about at the very, very beginning of this presentation. So what we're going to have you do is we're going to have you solidify your research questions. So that worksheet that we gave you for the active learning section, we did the breakout rooms. Let me just drop it in the chat, our homework stuff as well. Pretty much think about your topic, try to narrow it down and see like what your research question actually is. After you do that, you're going to try to find background information, and you can do this in a variety of different ways. I highly recommend looking in databases if at all possible to like find that information. Once again, if you don't have access through a university, definitely try a public library because they're wonderful resources. Then we're going to have you write down your keywords that you search. So when you're looking in the databases, like what words are you using to actually find that information within those databases? So when you're doing that, think of like your main words, think of synonyms, think of the way that people actually speak, the way that people write, and use those to try to expand your search. Then we're going to have you draft a protocol, which you'll see an example of in the homework document that we just dropped into the chat, but it's pretty much a combination of 1, 2, and 3, solidifying your research question, finding your background info, and then writing down those keywords that you've used to search. Additionally, sorry, I forgot about the last one. Pick another learning resources for this workshop to either listen to watch, or to read. If you haven't been able to start off with any of the resources that were originally sent out, go ahead and just try to read one of those. We're not going to be checking, so this is just for you.
Thank you, Laura, for introducing that. And if we just go to the last slide, we just want to say thank you, everyone, for coming and being so engaged. It was exciting to put this together. We were excited to share this, and we've been doing this work together, Laura and I, since I got here at Tulane a couple years ago, and just tons of evidence that this is work we're doing. And we're so excited to share everything we've been learning, tips, tricks, and things to make this go faster. But here's our contact information. Feel free to reach out to us, and you'll hear from us in an email with some follow-up materials, resources, and things for homework as we prepare for session 2, which is going to be on July 20, I believe it is the 6th. Yes, same time at noon Central. Thanks for coming, everyone. Appreciate you being here.
Feel free to ask questions on the Padlet in between sessions if anything pops up while you're looking through anything.
The Padlet is going to stay open.